Thank you so much for joining us on the show today. I want to get into your Pink Wellness House that you've come up with and built. But before that, what are, we see people all the time suffering with this, and you've spoken about it, how it's one of the #1 sicknesses here in East Africa, and it doesn't get that much attention. Can you just tell us about the Radiotherapy Cancer Centre? How much of an impact do you think that's going to make on recovery here in Rwanda, and why you think more attention hasn't been paid to this silent killer?
This is the proudest moment in my journey with breast cancer or cancer per se, witnessing Rwanda get the radiotherapy, which actually they're calling Rwanda Cancer Centre, launched by His Excellency, the President of Rwanda. This means that Rwandans do not have to go outside, spend all the little money they have, sell their houses, sell their property, cows and whatever, because radiation therapy is next door. So this is a major, major stride in fighting cancer in Rwanda.
Right. We do hear about this a lot. Once people are diagnosed with a certain stage of cancer, they have to leave the country to be treated. How far can someone go in terms of treatment here in the region without having to travel internationally?
Now Rwanda has spaces, facilities to offer chemotherapy. They have hospitals that are performing surgery. Now, on top of that, as the icing on the cake, they have radiotherapy, which most of the patients in the past have had to go to Uganda until theirs broke down, and then to Nairobi, and then to India and other developed countries. This means that the patients who are here and who are suffering from any kind of cancer can have their treatment right here at home, which makes it much affordable, and therefore we expect to get more survival rates in Rwanda than we have done before.
Right. You founded a recovery house called the Pink Wellness House, if I have the name right.
Yes.
Tell us about that. Why did you decide to do that, and what exactly does it offer?
The Pink Wellness House is a miniature of my dream, which is to have a place where patients can come in after treatment, if especially they are coming from the villages far from the hospitals. They can come spend a day or two, or even longer when we are able to provide the services, and nurtured, counseled, and before they leave for home, they feel better than they came to have their treatment. So it's a place that we also use, it's an activity and service kind of center. When I call it center, it sounds big, but it's really a miniature place, heaven for breast cancer survivors, breast cancer patients, ordinary people who need life-saving information. And also it's the place we call office, because this is where we meet, this is where we train, this is where we do things like we do provide, we make knitted prostheses, and this is where the women come and receive the materials and then take them home, and then they bring back to the Pink House. We check them and then we stock them, and if any woman has had mastectomy, can come and access them.
Right.
Yes.
You mentioned that it's something necessary for the women who are coming from the villages, or even here in Kigali, to get that support that they need.
Yes.
But what kind of numbers are we talking about here in Rwanda anyway? What is the prevalence of breast cancer?
Unfortunately, I'm not able to give you specific numbers, because RBC had just announced that now Rwanda is going to be having a registry. I haven't had a chance to go and study what they have, but at one time they were talking about 1 out of 4. And then we have a statistic that I always quote. If you compare US, where I come from, out of 10 women in the US, 2 die. In Africa, or Rwanda specifically, out of 10, 7 die. So that gives you a picture of how dire the picture is here,
right,
and how we need to do something about it.
Right.
And the source of all this is lack of awareness, because most of our women who have been diagnosed with breast cancer wait until the cancer, the pain from cancer, drives them into the hospital. And by then, when cancer has spread to other organs, it's both costly, difficult, or impossible, and most of them die.
Right, we do hear about this a lot of times in different campaigns and in the news, that early detection is one of the main ways that it can be prevented. What needs to happen for, because we have seen some campaigns here in the country, but what needs to happen for the number of mortality to go down and for that awareness to be raised here in Rwanda?
Makeda, early detection is the best protection. And in Kinyarwanda, kwisuzumisha kare niko kwirinda nyabyo. How do you get to that? I have 3 words that I teach my women and men. Ikunde, imenye, isuzumishe, which means love yourself, know yourself, and get checked. Because once you go through that process of transforming your mindset and how you look at life, you're going to take care of yourself. So it behooves everybody in Rwanda to start thinking about themselves. What is it that I want to do? Today is World Cancer Day. You know what I say? Every day is Cancer Day.
Right.
And until we wipe this scourge off the face of this earth,
the work won't be done.
Yes.
Thank you so much, Philippa, for joining us on the show today on the occasion of World Cancer Day, and we'll definitely be following up. Thank you for all your hard work.
Thank you so much.